Bronchitis is the inflammation of the mucous membrane in the bronchial. It typically causes a bronchoscoscon. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis may be either acute or chronic. Acute bronchitis is very common. It develops from a cold or other respiratory infection. Chronic bronchitis is a more serious condition. It is a constant irritation or inflammation of the lining of the bronchial tubes, often due to smoking. Symptoms. For either acute bronchitis or chronic bronchitis, signs and symptoms may include cough, production of mucus or sputum which can be clear, white, yellowish gray or green in color. Rarely, it may be streaked with blood. Fatigue, shortness of breath, slight fever and chills. When to see a doctor. See your doctor if your cough lasts more than 3 weeks, is accompanied by fever higher than 38 degrees, produces discolored mucus and sometimes blood, and is associated with wheezing or shortness of breath. Risk factors. Factors that increase your risk of bronchitis include cigarette smoking. People who smoke or who live with a smoker are at higher risk of both acute bronchitis and chronic bronchitis. Low resistance. This may result from another acute illness, such as a cold, or from a chronic condition that compromises your immune system. Older adults, infants, and young children have greater vulnerability to infection. Exposure to irritants on the job. Your risk of developing bronchitis is greater if you work around certain lung irritants, such as grains or textiles, or are exposed to chemical fumes. Gastric reflux. Repeated bouts of severe heartburn can irritate your throat and make you more prone to developing bronchitis. Prevention. To reduce your risk of bronchitis, observe the following. Avoid cigarette smoke. Cigarette smoke increases your risk of chronic bronchitis. Get vaccinated. Getting a yearly flu vaccine can help protect you from getting the flu. You may also want to consider vaccination that protects against some types of pneumonia. Wash your hands. To reduce your risk of catching a viral infection, wash your hands frequently and get in the habit of using alcohol-based hand sanitizers. Wear a surgical mask. If you have coughed, you might consider wearing a face mask at work if you're exposed to dust or fumes, and when you're going to be among crowds, such as while traveling. Thank you for watching. Please like and subscribe and click the bell icon to get new video updates. Goodbye.